Hello, everybody, and welcome to Reach Student Programs Career Chats. My name is Joan Dixon, and I'm the Director of Student Programs at Gulf Coast South Area Health Education Center. We welcome you today. We're so happy to have you here for the Career Chats program, where you can learn a little bit about some different health careers to see, what do you want to be when you grow up? You may have an idea, but there's over 300 different careers to choose from in health. So it's wonderful for you to do some research, for you to hear from all different career fields. First, I want to tell you about some of the other programs we have at AHEC so that you understand all the different opportunities that we provide to you. And have I mentioned yet that all of our student programs are absolutely free? It can begin with our career presentation video on our website, or many of these career chat videos, like the one you're going to be watching today. We've got a career chat video library on our website. We also hold career camps every summer. You'll see the virtual videos out on the website, or we might be able to do one in person this year. Keep an eye on the website for the applications. They usually come out mid-April. We also work with HOSA clubs in several different schools throughout our 4-county service area. We have Reach intern programs for students who are interested in the public healthcare field. And of course, our crowning glory is our AHEC Scholars program. So many different programs to check on our website. You can see the website listed at the bottom, as long as my phone number and my email there as well. I am very pleased to bring to you today Rana Seipel. She is a registered medical assistant, and she's going to share some information about her job. But first thing I want to show you is a nice overview video off of YouTube. It's a day in the life video. Let me bring this up here. Takes about 3 minutes.
A medical assistant is expected to perform a wide range of administrative and clinical tasks. In short, their role makes the work of doctors and nurses easier. The medical assistant is crucial to helping the office run smoothly and providing excellent customer service to the patient. What does a typical day look like for a medical assistant? Stay tuned to find out. Upon arrival, on an average day, a medical assistant begins by checking the appointment schedule. They'll find out which medical providers they'll be working with that day and call patients to remind them of their upcoming appointments. Medical assistants may be working with many doctors or a mix of nurse practitioners and doctors. Next, the medical assistant will help prepare the exam rooms and ensure the necessary medical supplies are set up. Medical assistants will also clean the room and prepare it for the next patient. Before moving on to assist the patients, the medical assistant will usually check in with the nurse practitioner or supervisor to see if any administrative or clinical duties require immediate attention. Daily tasks. Many of the tasks a medical assistant performs are administrative. Smaller doctors' offices require skill in both back and front office and will usually request support in both areas from their medical assistant employees. The medical assistant usually checks and updates patient records and reviews medical histories. They also handle billing and insurance matters. When patients need to fill out forms, it is usually the medical assistant who assists them. Other tasks the medical assistant may perform have to do with patient support. Some of these tasks include interviewing patients about their symptoms and getting their medical history. Medical assistants also take patients' vitals and measure their weight and height. Additionally, medical assistants may be asked to record the results of any lab tests. Finally, medical assistants may be asked to support other medical professionals with exams and treatment, such as lab tests, and provide additional support to the patient as requested. In busy office settings, patients are scheduled only 15 minutes apart. This means medical assistants are on their feet most of the day. When they do have downtime, medical assistants log into their facility's systems to communicate with patients. They make outbound calls to the patients to discuss preparation for tests or changes in schedule. End of day. Once patient exams have finished for the day, the medical assistant helps clean the exam rooms and put away the medical equipment. It is the responsibility of the medical assistant to ensure the exam rooms are properly stocked for the next day and all specimens requiring testing are dealt with on time. Finally, the medical assistant makes sure all prescriptions and paperwork are addressed before heading out for the day. Work schedule. Medical assistants may have the option of working part-time or full-time with shifts either in the morning, afternoon, or evening. They typically work a 40-hour full-time work week with the possibility of working overtime or taking weekend shifts. Are you a good listener? Do friends describe you as empathetic or non-judgmental? Do you consider yourself highly organized and enjoy helping others? Do you have good attention to detail? If so, then the role of a medical assistant may be for you.
All right, Rana. So that was a nice general overview. Now I understand that you are a registered medical assistant. So I imagine you may have some additional duties that we did not get a chance to see in that video. So when you're working as the lung nodule program coordinator at Sarasota Memorial Hospital, what additional duties do you perform above and beyond what we just saw in that video?
Well, I perform more of researching patient histories and finding out with incidental pulmonary nodules if it was a true incidental finding that was just found, or was this nodule on their lung in prior scans. So that's one thing that I do a little differently than the other RMAs would probably have to do.
So you bring up a very good point, is that if you've seen one medical assistant, you haven't seen them all, because you can specialize in so many different areas. Is that true?
There is so many areas that a registered medical assistant can get into. You can work in a family practice office. You can work in a specialty office, which would be hematology, oncology, dermatology, pulmonary. There's so many fields to choose from, and pediatrics. A lot of registered medical assistants love working with kids and choose to go to pediatrics.
Now you work as the coordinator of the lung nodule program at Sarasota Memorial Hospital. And some of the students listening to this video may not understand what is a lung nodule. Can you tell us a little bit about that program and your role in it?
Sure. Well, we all know we all have a set of lungs, and sometimes we have difficulties breathing. Could be due to asthma, or it could be due to a pulmonary embolism. There's so many reasons why lungs don't work properly, and one of those happens to be pulmonary nodules. And my part, or my role in working in the lung nodule clinic, is to monitor scans, whether it be a CT scan, PET scan, MRI, X-ray, and seeing if a patient has been found to have an incidental pulmonary nodule, meaning it has never shown up on any other scans prior to this particular scan. Then I go into the patient's history to see if, one, are they a smoker? If they are a smoker, how much do they smoke? How long have they been smoking for? And factor that in. Then I reach out to their primary care physician. I send them a copy of the exam or the image. And I also send a letter to the patient letting them know about the finding and how to proceed with following up.
So it sounds like you have a very busy day, each and every day.
It is very busy.
What is the atmosphere like there working in a hospital setting?
In the hospital, it's great. You never know what you're going to bump into in the hallway. A patient who is looking for the ED might be, or emergency department could be the wrong part of the hospital, and you have to help them get to where they need to be and make sure that they are stable and able to walk the distance, or you wheel them to where they need to go. But as far as Sarasota Memorial Hospital goes, the one thing that I love about being at this hospital, everyone is so friendly. so pleasant, so knowledgeable. And today it was just announced by News Weekly that Sarasota Memorial, for the 4th year in a row, has become one of the top medical facilities in the country. That's going by 27 different countries. So that's great. I'm proud to be a part of that.
That is phenomenal. And you mentioned all the staff work. Well, there are literally hundreds of staff members working at Sarasota Memorial Hospital. And anybody who watches these career chat videos knows that none of these professionals works alone. There's always a team surrounding them. So as a medical assistant, what other health careers do you work with?
With my situation that I'm in, I mainly work with the oncology team and the pulmonary team. I work side by side because some of the pulmonary nodules that I do come across and patients follow up and have testing done, 5% of those are cancerous nodules. So I coordinate their follow-up care with our oncology team.
Okay. Are those physicians, physician assistant, nurse practitioner, x-ray techs? What are all the different careers that work together in there?
I mainly work with the radiologist, nurse practitioners, nurses, registered medical assistants, and on occasion, I get to speak with the physician directly.
And what's a typical day like, or is there any such thing as a typical day?
In my department right now, it's pretty typical. In most offices, it's not typical. Or other departments in the hospital, it's not typical. You never know what's going to walk in the door. But with what I do, I come in the morning at 7:30, I look over emails, then I bring up my 2 systems that I work out of. One is Eon, the other is Allscripts. And those 2 systems sort of talk together, and Eon pulls any type of imaging that has been done, performed the day before, and it looks up for certain words, nodules, lesions, pulmonary, incidental, and pulls any reports with those words. And then I go into the patient's chart, review their scans, review their history to find out if it is an incidental pulmonary nodule, and then how to proceed for follow-up.
The hospital software that you mentioned, a lot of students might know Microsoft Word, Microsoft Excel, but certainly haven't heard the software you're talking about. Is that something that you learn in school, in your program to be a medical assistant, or is it something you were taught on the job?
I was taught on the job for how to learn with Allscripts. There's also other software that other hospitals use. One is Epic. Epic is a large software company who works with the medical field. And you're able to pull in scans from other hospitals on the system. Unfortunately, Sarasota Memorial does not have it yet, but they will be getting it as they get bigger. But basically all of your software systems that you have to use on the job, you learn on the job. As far as Microsoft goes, you learn the basics in class, but the majority comes from on the job training.
Understood, because certain hospitals and clinics could be using different software, so that makes sense. Now, do you work a typical 40-hour week, or sometimes you have to put in overtime? What's the atmosphere look like there for hours?
Right now, I do a 40-hour work week. However, recently, because of COVID, I've been helping at our urgent cares and doing COVID swabbing. So that's consists of overtime. But for the most part, it's 40-hour work week.
Okay, and students always want to know, show me the money. So what's an average range of salary expectations for a beginning medical assistant and all the way up into management where you are? Okay,
so beginning right out the bat, fresh out of school, you just get your certification. You can make anywhere from 30 to 33,000 in the Sarasota area as a registered medical assistant. And then you can make more money by furthering your education or certificate of completion with that specializes with the office or practice that you're in. And you can make, as a registered medical assistant in this area, probably the highest is about $40,000 a year.
Okay. What made you decide to pursue a career as a medical assistant?
I love helping people. I love being able to help someone, whether it's educating them or cleaning a wound. It varies, but just knowing that I could be there for someone who's in need. And with my position now, I do a lot of educating about smoking and why it's harmful. And some of the things that I talk to patients about, they never realize. So to give them the knowledge and the tools to help quit, it's great.
Absolutely. How long have you been working in this field?
As far as the incidental pulmonary coordinator, I've been here 7 months, but as an RMA, I've done it for going on 6 years.
Wow. Was there any other path that you had? How was your path to a medical assistant? Was it a straight line or did you have a curvy path?
Oh, I did a curvy path, a very, very curvy path. Background in distribution and logistics. Then I became a veterinary technician for a while. And then that all leaded me to where I am today, registered medical assistant.
You know, we hear that again and again. In fact, I don't think there's ever been a single interviewee on these career chats that says, oh yeah, I knew from the age of 4 and I just went straight for it. No, there's all sorts of curvy paths because
Yes.
Sometimes it takes a while to figure out what you really want to do and what you're really good at. So.
Exactly. Exactly.
Now, does somebody in your profession experience traumatic events?
Yes. Working in the medical field and especially in the hospital setting, unfortunately, we experience death on a daily basis. And that's something that a lot of people don't prepare you for or talk to you about when you want to pursue a career in the medical field. But it's something that you really have to think about. When I started back as an RMA, I started in the emergency department. And I had my first coding case that came through the door, and we rotated with the team to do CPR. Unfortunately, the patient did not make it. So that was my first experience with death, and it was hard to accept when you were working so hard. But in time, you learn that you do your best. And unfortunately, we just can't save everyone, even though we try, but we can't take that personally when we lose a patient. And because of the medical field being such a team-driven career, you always have your coworkers and other members that you can talk to and help you work through your emotion. And then basically it's fast paced in the ED. So if you lose a patient, you have to quick accept it and move on because someone else needs your help. And you don't forget about that patient that passed or their family members. You just have to table it to the end of the day, and then you can all get together and discuss what happened and how you feel and how to get through it.
Thank you for sharing that with the students. I think it's very important that they understand that there's many different facets to having a health career, and sometimes they're not all wonderful. You're attempting to help people, and in some cases to save their lives, and it's not always going to be a 100% positive outcome. So thank you for sharing that with the students. But of course, we want to balance it out there. So my next question is going to be, what's the most satisfying about your career?
Knowing that I was able to help someone, whether it is, again, educating is a big part of what a registered medical assistant will be doing. Helping patients to treat a wound, how to clean a wound, how to wrap a wound. That's big help, because a lot of people, you have to understand, they don't have a medical background. So what you feel is common sense or common knowledge, a lot of people don't understand. So they don't know to clean the wound 2 or 3 times a day and to bandage it so it doesn't continue to get dirty. So just knowing that I was able to educate someone and they leave with a mindset of how to take care of themselves, it's a good feeling. It's one of those feelings that you really can't express. You have to feel it to know what I'm talking about. I just don't know how else to put it.
No, I understand. When we were watching the video clip and then hearing you talk about your different duties that you perform, some of them sound a lot like nursing duties. So can you lay out for the students, what is the difference between a practical nurse and a medical assistant?
Okay. With a registered medical assistant, we do more of the basic chart prepping and rooming patients, vitals, then scheduling appointments for them, doing insurance authorizations. And nurses, they have a bigger scope of practice. They have more responsibilities. One big responsibility that they have is handling controlled substances or doing IVs and making sure medications don't have contradictions and can go together. So with nurses, it's longer schooling and they do have more responsibility than what a registered medical assistant has. However, you're a team and everyone has an important purpose on that team. So,
thank you for explaining that, because if students are looking at their options and they look at the technical colleges like our local Manatee Technical College, Suncoast Technical College, and they see, well, you know, medical assistant looks like it takes about the same amount of time as practical nurse. So trying to weigh the options. So thank you for explaining the differences with that. I appreciate that.
The one reason I became a registered medical assistant is because I didn't know if I would be able to cut it as a nurse. Would I be able to clean a wound? Would I be able to assist a patient if they're bleeding without passing out? Would I be able to assist a patient when they're vomiting and not stand next to them and vomit alongside of them? So that's why I chose to be an RNA before investing so much more of my time and money into becoming a nurse. But I'm happy to say that I'm enrolled in the State College of Florida to get my RN.
Wow, so you're going back to school. You're never really done learning ever, are you?
Especially in the medical field, you're learning something new every day.
Now that brings up an excellent point, because students need to understand that just because you get into one career, that's not the end of it. You can always stair step into other careers, especially when within the healthcare professions. So how did your background as a medical assistant help you get into the nursing program?
Just knowing that I could handle the workload, I could handle the uniqueness of our patients and their needs. I started in family practice. I went to the emergency room, then I transferred into urgent care. Then I tried oncology and hematology. And that all together, all of my experience and knowledge working in those different departments brought me to where I am today and preparing me to become a nurse.
I tell you, your career really sounds like a good way to get a sampling of all different fields within the
Yes.
hospital and see what really is a good fit with you. And plus, keeps it interesting that you can
It does.
move around.
It does. It
Absolutely. So let's say we've got students hooked right now. They're watching this video. They're hooked. They're like, okay, medical assistant. I think that's a good way for me to start out. So how do they get, their middle school or high school? Now we need to ask the questions. How do they get from middle school or high school to where you are as a medical assistant? So my first question for you is, what types of classes did you take in high school that you find help you now in your career?
To be honest with you, none of the classes that I took in high school prepared me for this. In hindsight, I wish that I would have focused more on biology and the sciences, chemistry. That was probably my biggest mistake, because at that time I didn't know that I was going to be going into the medical field. We didn't have options or education or videos like this to explain the different careers that are out there. So I would just say you focus on your sciences, biology, chemistry, algebra. But if you have a hard time learning those, that's okay, because when you go into other schools, if it's a trade school or a college, there's always someone there to help you and guide you through.
Where did you go to school to become a registered medical assistant, and how long did it take you?
I went to Lincoln Technical School in Pennsylvania, and it was a 9-month program. The 9th month, we got to do internship, and I was fortunate to get into the ED. But some of my classmates, they went into different specialties for their internship, family practice, pediatrics. A couple of them got to go to the county jails and work alongside the nurses and medical staff in the jail. You never think of a jail having a medical facility, but they do. And it's very interesting to see.
After you graduate from one of those programs, you're never done learning. Do you have to do continuing education for medical assistants?
Yes. Every 3 years, I have to renew my registration, and I have to have the continued education. I think it's 36 points that I need. The program that I went through, it's Lincoln Tech. They have free courses, CE credits that you can do to get the points that you need to re-register. But there's classes online. The hospitals or physicians' offices that you work at, they always have continuing education that can go towards your 3-year or how many every year renewal for your license.
And so if students may be thinking, oh man, I thought I was done with school. Why do I have to keep going back for these CE credits? That's because there's always something new to learn for your field out there.
And it's not only the medical field. Any job that's out there, you're constantly learning something different about that position. So you have to keep in mind, no matter what you choose to do in life, you're going to be learning something every day.
Now, until they develop a money tree that we can grow in our backyard, we all worry about how we're going to pay for school. Can you share with the students, how did you pay for your education?
Sure. To start off with the RMA, I paid that out of pocket. I had to get some student loans, of course. However, when you start working for an organization, whether it's a hospital or physician's office, and you show them that you are very interested in what you're doing and you want to learn more and you want to proceed to the next level, a lot of them will give you money towards your education. Sarasota Memorial for nurses, they give you $3,800 a year to go towards your learning. And then you just have to sign a contract that you will stay with them after graduation for at least 18 months. If not, you just have to pay them that money back. And there's also scholarships too that you can look into getting.
That's wonderful. So you have scholarships, grants, you have employer assisted.
Mhm.
It's nice to know there's options. I'm glad that you also brought up student loans, because so many times those get a bad rap. Well, I'll take out a loan, I'm going to have to pay it back. Yeah, but you can be making some good money in the health
Yes.
careers, and loans are always going to get paid back. Or even now they've got loan forgiveness programs
Yes, they do.
as well.
Yes. Yep.
So we're getting ready to wrap up our interview for today. So let's leave these students with, what is your best piece of advice for students interested in becoming a medical assistant?
My best piece of advice, well, oh boy. Just be honest with yourself. Ask for help when you need it, or if you have a question. Your schools, they offer counselors, your teachers. You can always talk to them about what you need to do to prepare for your future in your career. So just I think that's the most important thing, is just be true to yourself. If you have a passion to work in a particular field, you can even call the establishment or a doctor's office, whatever it may be. Ask if you can shadow them for the day to help you to prepare, and just find people in that field and talk to them. No one's going to tell you to go away. Okay, this is a growing field. The medical field is growing and growing every day. We need new people. We will be more than happy to spend time answering your questions and helping you to guide and direct you through what you need to do.
And that is excellent advice. So students, if you're interested, whatever career you're interested in, do your research first so you can know all the pros and cons and everything in between, and then get out there and find a job shadowing opportunity, because there's no better way to figure out if you're going to enjoy something than to get out there and spend a day in the life of that career, figuring it out. Thank you, Rana, for taking time out of your busy schedule to talk to the students today. We really do appreciate it.
Thank you for having me. It was great.